I can't help myself. I just set the damn thing on fire. All right, this I think
Do it again, do it again.
I
Third
think
time's
this,
charm.
I
Third
think
time's
this is
charm.
edible.
You know, I'm still on my first one.
How are you doing this?
Oh. You know, that kind of summarizes my life. In an ideal world, how would you like a doctor to approach you and your concerns?
I don't think anyone has ever asked me in an exam about how my eczema is making me feel, or if it's impacting my mental health. I don't think anyone has ever asked me that. You know, so much of the eczema experience is your interaction with your dermatologist. And I think many of us leave those encounters feeling really unsatisfied. Many people feel they might be a burden or a nuisance if they say, geez, it's really affecting my sleep, or geez, it's really, affecting my relationships. So how do we even begin to have this conversation?
It's a great question. So dermatologists are really visual people. So I think we all fixate on the actual rash. But it's important to separate the rash and what you're visibly seeing from the person. I first off try to establish what is affecting you the most, and also what are your personal goals? Because who am I to assume that I know exactly what the goals are that the patients have?
So when it comes to, that goal setting, is clear skin the only metric?
Sleep is a very important endpoint. The appearance of lesions is very important. Anxiety and depression is very important. Absenteeism is very important. Not being able to even go to work. Social interactions are important. So what's hard for us is to know what's most important for which patient.
Right.
And so that's, I think, where physicians and patients coming together to make a decision falls off the wagon sometimes.
When we come to the doctor, I think so many of us are looking for validation and to really be seen, to have that lived experience really honored and also really cared for.
Absolutely, and that's really great to know because we see patients a lot and they have long waits. I mean, the waits are incredible and there's not a lot of time. So it is important, I agree, to acknowledge what folks have been going through to validate, especially if society doesn't value the emphasis on how severe that condition is.
And I think when you have a long-term chronic illness, there's a tendency to undertreat yourself because you could become accustomed to a certain burden of disease. You say, all right, I've learned how to live with this. And so, a reminder that you're worth being cared for, right, from your doctor is a very powerful thing. And that it's worth addressing, not just the health of your skin, but the health of your entire person. In what situation would I roast marshmallows with my dermatologist, Sean? Would that ever happen in real life?
We should change where we do appointments.